What makes Ra complications unique for each organ? Imagine a disease that doesn't just target your joints but can reach into almost every part of your body. Rheumatoid arthritis is a systemic autoimmune condition, meaning it involves the immune system attacking the body's own tissues. This widespread inflammation can cause different problems in different organs, and each one reacts uniquely because of its structure and function. The way Ra affects the heart, lungs, kidneys, bones, eyes, skin, and nerves varies because each organ has its own vulnerabilities and responds differently to inflammation. The common thread is systemic inflammation. Immune cells and inflammatory molecules called cytokines circulate throughout the body, causing damage wherever they go. But how each organ is affected depends on its specific makeup and how it handles inflammation. For example, the heart can develop inflammation of the blood vessels and the lining around it, which can lead to increased risk of heart attacks and strokes. This is partly due to inflammation promoting atherosclerosis, or plaque buildup, which can happen even if traditional risk factors like high cholesterol aren't present. In the lungs, Ra can cause interstitial lung disease, which leads to scarring of lung tissue. This makes breathing difficult and increases the risk of lung infections. The lungs are especially sensitive to prolonged inflammation, which can cause fibrosis or thickening of lung tissue. Meanwhile, the kidneys are affected mainly through immune complex deposits or side effects of medications. Their unique blood vessel structure makes them vulnerable to damage from systemic inflammation, leading to impaired filtering and function. Bones are another target. Chronic inflammation stimulates bone resorption, leading to osteoporosis, which weakens bones beyond just joint erosion. Some treatments for Ra, like corticosteroids, can also accelerate bone loss. The eyes are affected differently too. Ra can cause inflammation of the sclera or uvea, leading to pain, redness, and even vision loss if untreated. Dryness of the eyes can also occur due to damage to tear glands, which is a secondary effect of immune activity. The skin can develop rheumatoid nodules, which are from lumps of inflamed tissue often found on pressure points like elbows. These nodules reflected local immune complex deposits. The nervous system can also be impacted, with nerve compression syndromes like carpal tunnel syndrome resulting from joint swelling. In rare cases, vasculitis, inflammation of blood vessels, can damage nerves directly. Treatments for Ra, such as corticosteroids or immunosuppressants, can influence these organ-specific issues. They might increase infection risk or cause side effects like bone thinning or eye problems, adding another layer of complexity to managing each organ's health. That's why monitoring is so important. Doctors perform lung function tests, cardiovascular assessments, bone density scans, and eye exams tailored to each patient's needs. Early detection of organ complications helps prevent serious damage and improves quality of life. In essence, the reason Ra complications are so different across organs is because of the interplay between systemic inflammation and each organ's unique structure and function. Vascular inflammation affects the heart, fibrotic changes impact the lungs, bone loss occurs throughout the skeleton, and glandular damage affects the eyes. Managing Ra involves controlling overall inflammation while paying close attention to each organ's specific risks. Always consult healthcare professionals for personalized advice, as individual experiences with Ra can vary widely.